we will discuss the skeletal system and its functions. Skeletal system consists of 1. Bone, a rigid body tissue consisting of cells embedded in hard intercellular material. 2. Cartilage, a firm tissue but is softer and much more flexible than bone. 3. Joint or articulation is the connection made between bones in the body. Number 4. Ligaments, fibrous cords that bind the bones together at joints. The skeletal system or the skeleton makes up to 20% of the person's weight. Adult skeleton contains 206 bones while children's contain more bones because some of them fuse together as they grow. The male skeleton is usually longer and has a high bone mass, while female skeleton has broader pelvis to accommodate for pregnancy and childbirth. Functions of the skeletal system. Number 1 is for support. Bones, the steel girders, and reinforced concrete of the body form the internal framework that supports the body and cradles its soft organs. For example, bones of the legs supports the body trunk to help us stand. Rib cage supports the thoracic wall. Next, for protection. Bones protect soft body organs. For example, fused bones of the skull provide a snug enclosure for the brain. Vertebrae surround the spinal cord, and the rib cage help us protect the vital organs of the thorax. Third, allow movement. Skeletal muscles attached to bones by tendons use the bones as levers to move the body and its parts. As a result, we can breathe, walk, swim, and throw a ball. The fourth is for fat storage. Fat is stored in the internal marrow cavities of the bones. Bone itself serves as a storehouse for minerals, the most important of which are calcium and phosphorus. Fat is stored in the yellow bone marrow. The last one is blood cell formation. Blood cell formation or hematopoiesis occurs within the marrow cavities of certain bones. And that is skeletal system and its
About
functions.
bone growth and development of skeletal system. The skeleton is formed of the two of the strongest and most supportive tissue in the body, which is the cartilage and bone. Yung cartilage, it's a flexible connective tissue. And yung bone naman, diba? Siya yung parang hard part. And yun yung lagi natin tatandaan. In embryos, the skeleton is made up of hyaline cartilage. But in young children, most of the cartilage has been replaced by bone. Ang cartilage natin remains only in isolated places such as the bridge of the nose, parts of the ribs, and joint. Nakikita niyo sa picture kung saan naka-locate yung mga cartilage natin. Yan. So, nakikita niyo yung blue. This is the hyaline cartilage sa parts ng rib natin, joint, and sa bridge ng nose. And marami din tayong iba-ibang cartilage sa skeletal system natin, which is the elastic cartilage sa tenga natin, yung fibrocartilage dito sa spinal column natin, and dito sa baba. Most bone develops using the hyaline cartilage structure as the model. The process of bone formation is called ossification. Yung bone formation natin, it is referred as an ossification. So yung skeletal bone natin begins to form during the first few weeks after conception. And after 8 weeks naman, the cartilage and connective tissue have developed a skeletal pattern sa embryo at which doon nag-uumpisa yung ossification. So, yung ossification, it involves two major phases. First is the hyaline cartilage model is covered with bony matrix, yung bone collar natin. And yung bone matrix, it is secreted by osteoblasts to form a bone collar. Now, the bone collar prevents nutrients from reaching the hypertrophic chondrocytes, causing them to degenerate. So, yun yung ginagawa ng bone collar. So, yung osteoblasts and osteoclasts, kailangan nila mag-work together to maintain the balance of bone loss and bone formation. So, yung bone matrix eventually grows para mag-surround yung osteoblasts and the bone material must be calcified. So, once surrounded na, the osteoblast can become a mature bone cell. Kaya, nire-refer siya sa osteocyte. So, and this is where the growth occurs. Embryo, it is filled with hyaline cartilage. Then, sa fetus naman, nagkakaroon na siya ng paunti-unting bone. Nagkakaroon na rin siya ng medullary cavity. And sa child na, meron tayong articular cartilage and epithelial plate. Babanggitin ko kung ano yan mamaya. And nag-growth na siya into weed. In fetus length. Sa child naman, weed naman. Most hyaline cartilage model had been converted to bone except for two regions, which is the articular cartilage, then the epithelial plate. We have the bone growth and bone remodeling. So, ayan, makikita natin sa picture. Growing bones also widen as they lengthen to maintain proper proportion. How do they widen? This process is called appositional growth. And like growth in length, it is controlled by hormones. And natatapos siya sa adolescence, when the epithelial plate are completely converted to bone. Doon naman tayo sa developmental aspect of a skeleton. As the fetus grow and develop, all of the bone model are converted to bone. Except sa skull natin, na merong has fibrous membrane connecting the cranial bones are called fontanelles. Kung, di ba sa sanggol, pag ginawa natin sila, yung pinaka middle part ng ulo nila is parang merong malambot. Ayun yung tinatawag na fontanelle. Yung soft spots ng makakapa natin na parang merong tumitibok-tibok. Yung fontanelle naman is, hindi siya delikado. Para siyang connective tissue. And, ayun nga, which explains their name, Little Fountain. May kita natin mamaya kung ano yung largest fontanelle, which is the anterior fontanelle. Para siyang diamond shape. Yan. Yun nasa middle part and pinaka sa taas ng ulo natin, which is the anterior fontanelle. Meron tayong posterior fontanelle, yung nasa baba. Then, dito sa gilid, yung mastoid fontanelle. Then, a sphenoidal fontanelle. The fontanelle allows the fetal skull to be compressed slightly during birth. In addition, because they are flexible, they allow the infant's brain to grow during the latter part of the pregnancy and early infancy. The fontanelle usually ossify by 2 years of age. So this is the purpose of the fontanelles. Para, di ba, as we grow older, baby, as we grow older, kailangan mag-expand ng brain. And yun yung purpose ng fontanelle. And it is usually ossifying. And tapos siyang mag-ossify into 2 years of age. During the puberty, the female pelvis broadens in preparation for childbearing. Diba? Para mga anak ng babae, kailangan mag-broad yung mag-broad yung balakang nila. And the entire male skeleton became more rounded. So, parang mas lalong tumitibay. Once adult height is reached, a healthy skeleton changes very little until late middle age. Kasi nga, fully developed na ngayong bone natin. So, may mapapansin na lang natin na there's little changes lang. But in old age, kapag tumanda na tayo, losses in bone mass became more obvious. Yan. This is the fontanelles. Yung parang may space. And kapag human adult naman, ayan, buo na siya. Ayan. Newborn, hindi pantay yung ulo at katawan niya, pero habang lumalaki siya, nagiging proportional na yung weight ng body and yung weight ng head.
Now let's move on to the classification of bones according to their shapes. There are numbers of bones in a human skeleton. At sa isang adult human skeleton, mayroong 206 bones to be exact. At itong mga bones na to, they serves as a protection at pati na rin para masuportahan ang body weight. The different types of bones have different shapes too, in which those shapes relates to its function and purpose. These are the 5 types of bones in skeleton. Ito yung flat bone, ito yung long bone, short bone, ito yung irregular bone, and the last one is yung sesamoid bone. Ang first classification of bone na aking i-discuss is yung flat bone. Flat bones are typically thin at madalas din na curve sila. Etong mga flat bones na to, they serves as a shield and protection sa mga internal organs, kagaya na lamang ng heart, lungs, yung mga pelvic organs, pati na rin ang brain. Flat bones provides as well yung mga large areas of attachment para sa mga muscle. So, ito nga yung mga example ng flat bones. We have the cranial bones. Ito yung skull. Pinoprotektahan niya yung brain. The sternum or the breastbone. Ito naman yung nagpoprotekta sa ating heart at pati na rin sa lungs. The scapulae or ang ating shoulder blades na ang function niya naman is for the shoulder motion. And we also have the ribs na nagpoprotekta sa ating lungs. The second one is the long bone. Long bones are cylindrical in shape. And also they are longer than they are wide. Ang function ng long bones na ito ay para masuportahan yung weight of the body, to facilitate the movement, and also it acts as a lever which moves when the muscle contract. So, mostly itong long bones ay located siya sa appendicular skeleton. Ayan yung sa upper limbs tsaka sa lower limbs. Okay. So, sa upper limbs, eto yung sa arm. Ayan. We have the long bones na humerus, radius, tsaka sa eto yung ulna. We also have dito sa fingers na long bones. Ayan yung metacarpal tsaka yung phalanges. Sa lower limbs naman, we have the femur. Ito yung longest bone in the body. We also have the fibula. Ayan. Tapos ito, tibia. Yan yung mga long bones sa lower limbs, sa legs. At ito naman yung metatarsals. Ayan. Tapos sa pinakadulo, we have the phalanges. Ayan, dito yung part na sa toes na meron ding long bones. The third one is the short bones. Short bones are cube-like in shape. Ito yung parang mga pa-square na shape ng buto. And approximately, they are being equal in length, width, and thickness. Itong mga short bones, they provide stability or yung sa balance. And also, they support some limited motion. The only short bones in the human skeleton are yung nasa wrist at saka yung sa ankles. So, madali lang natin ma-identify kung ano yung mga short bones dahil nasa dalawa lang naman sila. Okay, eto yung sa tarsals. Ayan. Yung sa paa. Eto portion na yan, puro short bones yan. Ayan, at sa nakalagay din sa description, cube-like shape. Ayan, makita naman natin na pa-cube yung kanilang shape. And also the carpals, ito yung nasa wrist natin. So, they are also cube-like na shape ng buto. The fourth classification of bone is the irregular bones. Irregular bones are complex shapes. They do not have any easily characterized shape. These irregular bones does not fit any other classification dahil nga wala siyang definite na shape or exact na shape. These irregular bones are for the protection din ng internal organs. Kagaya na lamang nitong nasa picture, itong vertebrae or ang ating vertebral column na pinaprotektahan ng ating spinal cord. Ito namang sacrum, ito yung closer picture niya. Ang function niya naman is to protect the lower back nerves. Other examples pa ng irregular bone is itong facial bones. Mas marami daw na irregular bones, particularly the ones na nagko-contain ng sinuses. And also, we have the irregular bones in the pelvis, yung pubis, ilium, ischium, na nagpaprotect naman ng ating pelvic organs. The last classification of bone is the sesamoid bones. Sesamoid bones are small round bones. From the word sesamoid, it is a sesame seed shaped like bones. These bones are usually found sa mga tendon na associated sa kamay, sa tuhod, at pati sa paa. And these bones help in overcoming the compressive or yung mga pressure and squeezes na types ng forces. These bones also protect tendons from the stress and the wears. Sesamoid bones also vary among person to person in terms of its number and placement. So, one example that I have here is ito pong patella. Ito. Or ang tinatawag din po nating kneecap. Ito lang po yung common na sesamoid bone na matatagpuan natin or makikita natin sa lahat ng individual.
The skeletal system overview. Axial and appendicular skeleton. The bones of the human skeleton are divided into two groups. The axial skeleton, or the bones along the body's long axis, while the appendicular skeleton are all of the bones that form the upper and the lower limbs, as well as the shoulder and the pelvic girdles. The adult human body has 206 bones, but a newborn baby has nearly 300 bones. It is because a newborn baby has more flexible cartilage that eventually hardens and turns into bones, while other bones just fuse together, ending up with 206 bones as an adult. The axial skeleton has three primary divisions: the skull, including the bones of the skull or the cranium, face, auditory ossicles, and the hyoid bone, the thoracic cage, including the rib cage and the sternum, and the vertebral column. So the axial skeleton supports and protects the organs of the dorsal and the ventral cavities. It protects the brain, the spinal cord, and other organs in front and back of the body. It also serves as a surface for the attachment of muscles and also stabilizes portions of the appendicular skeleton. So the skull is formed by two sets of bones, the cranium, which encloses and protects the fragile brain tissue, and the facial bones that forms a cradle for the eyes and makes up the face. The cranium or the cranial bones are composed of 8 large flat bones. They are all single bones except for 2 sets of paired bones, which are the parietal and the temporal bones. So the occipital bone, it forms the base and backbone of the skull. That is why it is the most posterior bone of the cranium, or yung pinaka matatagpuan sa likod na banda ng ating skull. 2 temporal bones lie inferior to the parietal bones, or nasa ilalim na banda ng parietal bones, while yung 2 parietal bones naman, ito yung pinaka superior or above, and binubuo niya rin yung lateral walls or gilid ng ating cranium. While yung sphenoid, it is a butterfly shape which spans the width of the skull and forms part of the floor of the cranial cavity. It serves as attachment sites for many muscles for mastication or chewing. Ethmoid, it is very irregular shape, lies anterior to the sphenoid, and it forms the roof of the nasal cavity and part of the medial walls of the orbit. And then the frontal bone, it is the forehead, the bony projections under the eyebrows, and the superior part of each eye's orbit. This is the illustration of cranial bones: the frontal bone, the 2 parietal bone, the occipital, 2 temporal bone, sphenoid, and the ethmoid bone. Skull sutures. So, as fontanelles close, sutures develop. So, familiar tayo sa mga baby na meron silang malambot na parte dito sa kanilang ulo, or yung tinatawag natin na bumbunan. So, yung skull sutures are immobile joints where cranial bones are connected with dense fibrous tissue. So, yung fontanelle na yon, ina-allow niya yung pag-develop ng brain and pag-expand ng skull. So, habang bata pa, syempre malalambot pa yung parte na yun ng ulo ng baby dahil kinakailangan niya pang ma-develop yung brain niya, and kapag na-develop yung brain, syempre mag-expand din yung skull niya. There are 4 major cranial sutures that can be found in the skull. So we have the lumboid suture, which lies between the parietal and the occipital bone, the squamous suture between the parietal and the temporal bone, the sagittal suture in between 2 parietal bones, and the coronal suture, which lies between the parietal and the frontal bone. So, yung mastoid, sphenoid, at posterior fontanelle ay nagko-close after 2 months ng baby, while yung anterior fontanelle naman, or yung bumbu na tinatawag natin, ay pwedeng magstay hanggang 2 years old yung bata. In facial bones, there are a total of 14 bones, 12 are paired, only the mandible and the palmar are single. So, this facial skeleton form the entrances to the respiratory and the digestive tracts. First is mandible, or the lower jaw. It is the largest and the strongest bone of the face. Superior edge of the mandibular body carries the lower teeth. The maxillae, it is the keystone because it serves as the articulation point for all of the facial bones, and it is fused to form the upper jaw, carry the upper teeth, and the maxillae also contains sinuses which drain into the nasal passages. Zygomatics, or cheekbones, forms a good-sized portion of the lateral walls of the orbits, or yung gilid na tong eye socket natin. The lacrimals are fingernail-sized bones forming part of the medial wall of each orbit, has a group that serves as a passageway for tears. So, di siya matatagpuan sa pagitan ng mata natin, dito sa pinaka-top nung bridge ng nose. Then, yung nasals, small rectangular bones forming the bridge of the nose, are the nasal bones. Vomer, single bone in the median line of the nasal cavity, forms the inferior part of the bony nasal septum, which separates the two nostrils, while palatines lie posterior to the vollative processes or extensions of the maxillae. They form the posterior part of the hard palate. So, ito naman is posterior na or nasa likod na parte na siya nung maxillae. So, yung bone na makakapa or masasalat nung dila dito sa loob ng ating mouth. So, nandun yung hard palate natin. If familiar tayo sa cleft palate, ito yung isa sa abnormal development kung saan hindi nagko-close or nag-fully develop yung tissue dito, kaya nagkakaroon ng butas or yung cleft palate nga na tinatawag natin. While yung nasal concave naman, it is a thin curved bones projecting medially from the lateral walls of the nasal cavity. So they increase the surface area of these cavities, providing rapid warming and humidification of air as it passes to the lungs. We have here an illustration for the skull sutures and as well as the facial bones. So pag sinabi nating medial wall, it is formed by the ethmoid, the lacrimal, and the sphenoid bones. So, the ethmoid bone separates the orbit from the ethmoid sinus. Pag sinabi namang lateral wall, it is formed by the zygomatic bone and the greater wing of the sphenoid, which is here. The hyoid bone and the auditory ossicles. So, yung hyoid bone, generally, hindi naman siya parte ng skull or ng facial structure natin. Pero since closely related siya sa mandible and sa temporal bones, kinlassify na rin siya na kasama sa ating skull and facial bones. So, the hyoid bone, it is the only bone that does not articulate or form a joint. It is suspended in the mid-neck region. Makikita dito sa illustration natin. So, laryngeal skeleton, nandito siya. And yung hyoid bone natin, wala siyang katabing bone, kundi nakahang lang siya dyan sa gitna ng ating neck. It serves as movable base for the tongue, as an attachment point for the neck muscles that raise and lower the larynx when we swallow and speak, and it provides an anchor point. The three smallest bones of the body can be found inside the inner ear, or our auditory ossicles, the malleus, incus, and stapes. These three bones articulate with each other and transfer vibrations from the tympanic membrane to the inner ear. So we have here the illustration of the inner ear bones, the malleus, incus, and stapes. This is the tympanic membrane or our eardrum. The second division of the actual skeleton is the thoracic cage. It consists of the sternum or the breastbone. It is a typical flat bone consisting of manubrium, body, and xiphoid process. It is attached directly to the first 7 pairs of the ribs by a costal cartilage and protects internal organs such as the heart and gives attachment to the muscles. So, rib cage. There are a total of 12 pairs of ribs, and the first 7 pairs attached directly to the sternum are called the true ribs, while false ribs are the next 5 pairs, either attached indirectly or not attached at all at the sternum. And the last 2 pairs of the false ribs lack the sternal attachment, so they are called the floating ribs. And the last division of the actual skeleton is the vertebral column. It is a flexible column formed by a series of 24 vertebrae plus the sacrum and the coccyx. It is the actual support of the body since it protects the spinal cord and the nerve roots. It provides structural support and balance to maintain upright posture. It also provides flexible motions. The vertebral column is grouped into 5 regions. The cervical spine, which provides mobility and stability to head. Thoracic spine, it is the longest region of the spine, only region attached to the rib cage. The lumbar spine, it carries the whole weight of the body. the sacral spine, which connects the spine to the hip bones, and the coccygeal spine serves as the site of attachment for multiple pelvic ligaments and tendons. This is the illustration for the vertebral column. Now we move on to the second division of the skeletal system of the body, which is the appendicular skeleton. It is composed of 126 bones of the limbs and the pectoral and pelvic girdles, which attach the limbs to the actual skeleton. So the appendicular skeleton includes the bones of the shoulder girdle, the upper limbs, the pelvic girdle, and the lower limbs of the body. The shoulder or the pectoral girdle consists of two bones. The clavicle, also known as the collarbone, it acts as a brace to hold the arm away from the top of the thorax and helps prevent shoulder dislocation. And the scapula or the shoulder blades or the wings, it provides attachment for muscles that moves the shoulders and the upper limbs. So this is the shoulder girdle, the clavicle, and the scapula or the wings. The upper limbs consist of three main bones: the arm or the humerus, which serves as an attachment to 13 muscles, the forearm, radius, and ulna. Radius functions are to articulate with the ulna, and humerus at the elbow to provide supination and pronation, while the hand and wrist are composed of carpals, metacarpals, and phalanges. So carpals are bones of the wrist. There are 8 carpal bones arranged into irregular rows to form wrist, or what we call the carpus. So metacarpals, bones that form the palm of the hand. Phalanges, which are the bones of the fingers. Each hand contains 14 phalanges. So this is the illustration of the bones of the upper limb, hand bones, and the wrist bones. The third one is the pelvic girdle. It is formed by 2 coxal bones, or what we call the hip bone, and the sacrum and the coccyx. So the coxal bone is formed by ilium, ischium, and pubis. Ilium connects posteriorly with the sacrum. It has a weight-bearing function that carries the upper body, while ischium, it is the sit-down bone. It serves as an attachment for the posterior thigh muscles. It also carries weight of the body when we are sitting. The last one is the pubis. It is the most anterior and inferior part of the coxal bone. 2 halves of the pubic bones are joined in the middle by an area of cartilage called the pubic symphysis. So for the comparison of female and male pelvises, technically, mas malaki talaga yung hips or yung pelvic region ng mga babae, mas broader, dahil ito sa pag-adapt ng katawan ng mga babae sa kanilang panganganak or sa kanilang pagbubuntis. So the female ilia flare more laterally, giving women curvy hips. So yun din yung nagbibigay sa mga babae ng magandang shape. So the last part is the lower limbs. It includes bones of the thigh, or what we call the femur. It is the heaviest, strongest, and longest bone in the body. Since yung lower limb natin, yun yung magkakarry ng whole weight ng body, dapat lang na mas thick and hard yung mga bone na nandun para masuportahan yung katawan natin. Then yung leg or the tibia, larger commonly known as the shin, and fibula. So thigh and leg bones articulate at the knee joint. It's protected and it has with the patella bone that supports the quadriceps tendon. So the foot consists of tarsus, metatarsus, and phalanges. For the tarsus, there are 7 tarsal bones. The 2 largest tarsals are what we call the calcaneus or the heel bone, and the talus or the ankle. The metatarsus has 5 metatarsal bones, each connected to the phalanges of the toes. While phalanges, those are the fingers of the toes. So this is the illustration of the foot bones. This is the phalanges, the metatarsals, and the ankle or the tarsals. Ito naman yung calcaneus or yung heel bone. Ito naman yung illustration ng ankle bones or nung tarsals, nandiyan yung calcaneus, cuboid, cuneiforms, navicular, and the talus. Foot arches. It is formed by the interlocking bones and ligaments of the foot. It is the shock-absorbing features that support the body weight and distribute the stress evenly during walking. So I have two types of foot arches. The first one is the longitudinal arch that runs from the calcaneus to the heads of the metatarsals. So it has two types, the medial and the lateral longitudinal arc. The other one is the transverse arc that runs across the cuneiforms and the base of the metatarsals. So this is the transverse arc which travels along this path. So yung mga taong merong flat feet or fallen arches, they're not proficient in keeping their body stable. So they are more prone to chronic muscle strain as their muscles are forced to compensate for the foot's lack of stability. And that is all for the overview of the skeletal system of the body. Thank you.
Classification of joints and joint movements. Joints, also called articulations. They are the sites where two or more bones meet. They have two functions. One is they hold the bones together securely. Second, they give the rigid skeleton mobility. So joints are classified in two ways, according to their function and according to their structure. Functionally, they are synarthrosis or immovable joints, ampliarthrosis, slightly movable joints, diarthrosis or freely movable joints. Structurally, they are fibrous, cartilaginous, and synovial joints. Classification of joints based on functions. Synarthrosis. It provides for a strong union between the articulating bones. This is important at location where the bones provide protection for the internal organs. So, examples include sutures, fibrous joints between the bones of the skull that surrounds and protect the brain, as well as the body of the sternum for the protection of the heart. Ampliarthrosis, it is a joint that has limited mobility. So an example of this type of joint is the cartilaginous joint that unites the body of adjacent vertebrae, which is what we call intervertebral disc. So a freely mobile joint is classified as diarthrosis. These types of joints include all synovial joints of the body, which provide the majority of body movements. So most diarthrotic joints are found in the appendicular skeleton, thus give the limbs a wide range of motion. So these joints are divided into three categories: the uniaxial joint, biaxial joint, and multi-axial joint. So uniaxial joint only allows for a motion in a single plane or around a single axis. An example of that is the elbow joint, which only allows for bending or straightening. So biaxial joint allows for motions within two planes. An example of biaxial joint is the metacarpophalangeal joint or the knuckle joint of the hand. So multi-axial joint is a joint that allows for the several directions of movement. This type of diarthrotic joint allows for the movement along three axes. So a multi-axial joint such as the hip joint allows for three types of movement: the anterior posterior, the medial lateral, and the rotational. Classification of joints based on their structures. First one is the fibrous joints. So these are the bones united with the fibrous tissues. An example of these joints are suture, syndesmosis, and gombosis. So when we say suture, it is a joint held together with a very short interconnecting fibers and bone edges interlocked, found in skull. Syndesmosis is a joint held together by a ligament, and the fibrous tissue can be vary in length but is longer than in sutures. So an example of that is the joint between the tibia and the tibia bone. Composes, like in socket fibrous joint, the periodontal ligament holds tooth in socket. Cartilaginous joints. It comes in two varieties which differ in type of cartilage involved. So the first one is synchondroses, or the bones united by a hyaline cartilage. So an example of that is epiphyseal plate, or the temporary hyaline cartilage joint. Sternum manubrium, the joint between first rib and the sternum immovable. The second one is the symphysis, or the bones united by a fibrocartilage. An example of that is the pubic symphysis, which connects the pubis, the two pubic bone of the pelvic girdle. Synovial joints are joints in which the articulating bone ends are separated by a joint cavity containing synovial fluid. Synovial fluid, it is a viscous fluid found in the cavities of synovial joints, whose main purpose is to reduce friction between the articular cartilage of synovial joints during movement. So it allows for free movement between the bones, and synovial joints are the most common joints of the body. Movement at synovial joints. Gliding movements occur as relatively flat bone surfaces move past each other, but they produce a very little movement of the bones. We have the angular movements, so produced when the angle between the bones of a joint changes. They include the flexion, extension, hyperextension, abduction, adduction, circumduction. Rotational movement. It involves moving the bone around its longitudinal axis. So this can be movement toward the midline of the body, or the medial rotation, or away from the body, from the midline of the body. So it is a lateral rotation. Special movements. All the other movements that cannot be classified as gliding, angular, or rotational. So these movements includes inversion, eversion, protraction, retraction. Types of synovial joints based on shape. So plain joint are essentially flat, and only short slipping or gliding movements are allowed. So the movements of plain joints are non-axial. So that is gliding back and forth and does not involve rotation around any axis. The example of this type of joint is the intercarpal joint of the wrist. Next is the hinge joint. It has a cylindrical end of one bone which fits into a throw-shaped surface on another bone. So hinge joints are classified as uniaxial or one axis. They allow movement around one axis only. Angular movement is allowed in this one plane, like a door hinge. So examples are elbow joint, ankle joint, and the joints between the phalanges of the fingers. Pivot joint. The rounded end of one bone fits into a sleeve or a ring of bone, and it is classified also as uniaxial joint. Pivot joints hold the two bones of the forearm together. Pivot joint located near the elbow joins the bones of the forearm, called the ulna and the radius, to each other. Condylar joint, or we call a knuckle-like. The egg-shaped articular surface of one bone fits into an oval concavity in another. So the condylar joints allow the moving bone to travel from side to side, back and forth, but the bone cannot rotate around its long axis. So movement occurs around two axes, hence these joints are biaxial. Spinal joints. Each articular surface has both convex and concave areas, like a saddle for a horse. So these biaxial joints allow essentially the same movements as cannular joints. And the best examples of azodial joints are the carpometacarpal joints in the thumb, which are responsible for our opposable thumbs. Ball and socket joint. So the spherical head of one bone fits into the round socket in another. So this multi-axial joint allow movement in all axes, including the rotation. So the shoulder and the hip are example of the ball and socket joint. We have here a table for the summary of joint classes. So we have structural class, structural characteristics, types, and mobility. So that's all for the classification of joints and joint movements. Thank
Disorders
you.
in skeletal system. So osteoporosis causes bone to become weak and brittle, so brittle that a fall or even mild stress such as bending, coughing can cause a fracture. Osteoporosis-related fracture most commonly occur in hip, wrist, or spine. So, osteoporosis can affect men and women, but it is more common in women, and older women are the high risk. So, rickets is a skeletal disorder that caused by lack of vitamin D, calcium, or phosphate. These nutrients are important for the development of strong, healthy bones. People with ricket may have weak and soft bones, stunted growth, and severe cases skeletal deformities. So ricket is most common in children who are between 6 and 36 months old. Bone cancer is when usual cell grow out of control in your bone. It destroys normal bone tissue. It may start in your bone or spread from other parts of your body called metastasis. So, bone cancer or bone tumors are benign, which means they aren't cancer and don't spread to other areas of the body. So, these are the few common types of benign bone tumors. So, osteochondroma, giant cell tumor, osteoid osteoblastoma, and chondroma. So fracture. A broken bone or bone fracture occurs when a force exerted against a bone is stronger than the bone can bear. This disturbs the structure and strength of a bone and leads to pain, loss of function, sometimes bleeding, and injury around the site. So broken bone takes around 4 to 8 weeks to heal, depending on age and health of a person and type of break. Osteoarthritis is the most common form of arthritis, affecting millions of people worldwide. It occurs when the protective cartilage that cushions the ends of your bone wears down over time. Although osteoarthritis can damage any joint, the disorder most commonly affects joints in our hands, knees, hips, and spine. Gout. It is a common and complex form of arthritis that can affect anyone. It's characterized by sudden severe attack of pain, swelling, redness, and tenderness in the joint, often the joint at the base of the big toe. Gout occurs when uric crystals accumulate in your joint, causing the inflammation and intense pain of gout attack. Uric crystal can form when you have high levels of uric acid in your blood. So that will be all. Thank you.